Welcome back. We continue to follow some massive breaking news on the COVID-19 vaccine front. The Pfizer vaccine, we are now hearing 95% effective. That's going to be submitted to U.S. regulators for emergency approval in just days. What could that mean for rollout? We are joined right now by infectious disease expert specialist Dr. Isaac Bogosh for reaction on this incredible news. Good morning to you, doctor.
Oh, good morning.
So your thoughts on this? This is definitely groundbreaking.
Yeah, this is phenomenal. It's absolutely amazing to watch. Now, I still think we need to be cautiously optimistic because we don't have access to the data. This is, science by press release, but the snippets of data that we have available look phenomenal. They've completed the study. They enrolled over 43,000 people in this trial. Half of them got a vaccine. Half of them got a placebo. It was just saline. And then they watched everyone go through the trial. And during this trial, there were 170 cases of COVID-19, and 162 of those cases were in the placebo group. That's a massive difference between the placebo group and the vaccine. So they're saying that this can reduce the risk basically by about 95%. Now, we have to see how this actually works in real-world settings. It might not be as amazing as it looks like in the trial, but I mean, based on the snippets of data that we have available to us, this is very big news, and it's wonderful to see. I mean, it's been a year of a ton of research and development in this. We all know how significant the COVID-19 pandemic has played out. And it's nice to know that these are products that will very, very likely roll out in the near horizon. It might even be as early as late 2020 in the United States, as Dr. Anthony Fauci has said, more likely in Canada early the first quarter of 2021. So it's a big deal.
Significant indeed. Okay, thank you so much for your comment on that. I know you joined our show for a separate segment, but we wanted to get your take on that, so appreciate it. Thank you so much. And the other thing, you're talking about products that are on the shelves. Do they work? Let's bring you over to Dina.
Thank you so much, Mel. Yeah, Dr. Bogosh, good to see you. It is encouraging news, but before the vaccine becomes available, we want to break down all these products flooding the market with our hard-earned cash. We're spending money hoping to prevent the virus from spreading. So we want to get your take. There's things like antiviral tissues that claim to kill 99.9% of viruses in 15 minutes. What do you say to that?
Yeah, I mean, there's a lot of commercially available products, wipes and tissues and stuff. And I think that, sometimes you see some huge claims on the front, but there's a whole variety of, for lack of a better word, chemicals that go into that really will help sterilize surfaces. They actually will help, and they will help clean off surfaces to make them a little bit safer. And I don't think it's a bad idea if you have a lot of high contact surfaces to keep them clean. Soap and water also does the trick. Okay. But these wipes will certainly help too.
Have you seen these wall plug-in air purifiers? What do you make of those?
A little skeptical. Yeah. I'm pretty skeptical in general, but there are some things like products like that. And I'm not going to comment on individual products, but when you start to see products that sort of claim that they're going to purify the air, and it's just you're plugging a little something into the wall, you got to be a little skeptical. And really, I think the key message is to really fundamentally stick to your public health measures. Put on a mask indoors if you're in another person's house, which we probably shouldn't be going to, but if we're in other indoor settings, wash your hands, spread apart by a couple of meters, really see if we can improve the ventilation of the house, because I don't think relying on little products to plug into the wall are going to be effective.
Let's debunk this one. I'm hearing a lot about UV sanitizers. Well, you plug in this slide and poof, everything disappears. They're portable ones. What do you make of that?
Okay, UV is actually pretty interesting because in certain medical and industrial settings, they are using UV light to help sterilize surfaces, and it does work. But this is UVC light, and it's just to be clear, the lights that they use in medical and industrial settings to do this are dangerous. Like you would have nobody in the room when you're using that product. And there are some commercially available products that are rather effective. Now, when we start to think about products that people are going to bring into their home environment, I mean, that's a completely different situation. And, A, it's unclear what light is being emitted from what product. B, again, sort of back to our comment from a couple of minutes ago, we should be skeptical about this. And C, the ones that are used in real world settings that actually have approval to be used and have data that back them up, really are not safe for humans to be around when they're being used.
Good to know. Amazon's offering the UV sanitizer box for face masks because a lot of people are like, I want to reuse, I want to recycle. I'm sick of washing them. What do you make of that?
In all fairness, if you have a mask, most people are wearing cloth masks, and I think washing a cloth mask is completely effective. The other thing too is some people have several masks, and if you just leave your mask out for a day and swap between one mask and another mask and have a decent time interval between wearing them, like a day or so, I think we should be fine. Still, I mean, I know it's important to wash our hands. I know it's important to wipe off high contact surfaces. But I think it's also important to remember that the conversations we were having in March and April about touching an inanimate object and getting infected by touching your eyes, nose, and mouth, it's still real. Like, we still have to be careful about that. But I think in March and April, many of us, myself included, we just didn't know enough at that time. We thought the risk was this big, and in actual fact, the risk is much, much, much smaller. So wash your hands, wipe off high contact surfaces, but I think we don't need to take it to the nth degree of starting to sterilize every square inch.
Okay, and this disinfectant water generator, I don't even know what that's all about. Have you heard of this?
No.
Okay.
Don't know.
We don't know, but
don't have a clue.
Oh, there it is. Yeah, I don't even know how that works. It looks like sort of like a misting. I don't know what the heck that does. But yeah, if the science seems sketchy, probably is. Last myth to debunk. Is it true, Dr. Bogosh, let's get to the bottom of this, that you were separated at birth from one Noah Wiley, who starred in the series ER? Pictures, side-by-side proof. There we go.
Oh, my God.
Dr.
No,
Bogosh.
we don't even look even close. Not even close.
Is it true that you were separated at birth?
Look at that.
Okay,
oh,
so,
no, it's that way.
So look
That's
a little
a very
bit.
good-looking man.
Yeah, could you look a little bit?
No,
look to your
not
left.
Even close.
Look to your left, Dr. Bogosh. Into the horizon. To the left. Keep going.
No, I'm good.
Okay, debunking all kinds of myths. Speaking of, I know you're busy, so thanks so much for your time. It's always so good to hear from you. Take care.
Have
Stay
a great
safe.
day.
Thank you. You too. We'll be back with more BT right after this.